One of the worst storms in decades has hit the country. And in Barnsley, a severe weather warning has been issued.
There are 11 flood warnings in place today and 60-mile-an-hour winds hitting us right now.
Storm Eunice is causing havoc. And the department is bracing itself.
How far away are you?
It's not long before paramedics bring in the hospital's first victim of the storm. 88-year-old Enid has come in with husband of 30 years, Gordon. She split her head open and has a severe 8-inch wound.
I won't let the nurses know you're here.
I'm behind you.
Oh, sorry, Chloe.
Nurse Chloe is on hand.
We're in A&E. All right.
Has Doctor seen this yet?
Somebody has, yes.
Is Ros all right?
How have you done it?
Walking in town and I tripped and the wind, very strong. The wind blew me and I went straight into the side of Bolt's window.
Oh, do you
The
know
side.
what though? That nearly happened to me this morning because I nearly went on the wind.
Well, I went over. Stick went from under me, I went down.
Oh.
Not yet. They haven't decided yet.
Just put the phone down now. Talk later.
Hey, what, love?
Well, I'm hoping Doctor will be coming to sort it out soon and get it all closed up for you, alright?
Has it stopped bleeding?
It's not bleeding now, it's just a wound. It's not bleeding, it looks to have clotted a little bit, so it looks to have stopped.
Has it stopped bleeding?
Yeah, it looks to have stopped bleeding.
She lost plenty.
Yeah, well, I can imagine.
There's nothing worse than a head wound for bleeding, is there?
No, well, you've got loads of vascular
Yeah, it comes every time.
network.
Don't talk
I
about
can't
it,
tell
please.
you that, I don't know.
Don't talk
I
about
don't know.
it, please.
We'll see what Doctor says. If you need OTIC meantime though, if you just press the orange button
Yes.
and it'll set a beep off outside your queue so we can come in and see what you want in. Is that alright?
Right.
It's important Nurse Chloe assesses Enid
Oh, I like nail polish.
to see if there are any signs of brain trauma.
Do you know where you are at the moment?
Yes.
Where are you?
I'm in Barnsley Hospital.
Wonderful. What month are we in?
February
February.
16th.
What one Monday?
Monday.
Yeah.
It was Valentine's Day and I got a
Oh.
Valentine's card as well.
Did you? I think I know.
Didn't I not get a Valentine's card?
Of course you did.
Being elderly, Enid is more susceptible to developing a fatal brain injury
Yes, I know.
and will need to be closely monitored.
I wish I'd never got out of bed this morning. I wish I'd
Hello.
stopped in bed. I was safe in bed.
Okay.
Outside hospital, the gale force winds are not letting up. Nurse Greg and some of the paediatrics team see what's going on.
God, it is windy, isn't it? Hopefully it keeps the patients away. What storm is it again? Eugene. Eugene.
But it's not just the storm that's bringing in patients. Consultant Dr. Sue Mason takes the call for the next emergency. Paramedics have rushed in a 44-year-old man with chest pains and an accelerated heart rate.
Hey Darren, how you doing?
Yeah, is it water?
A little sip of water.
Right.
I'll get you a little tiny sip, but we're going to connect a drip up so you don't get too dry anyway.
Registrar Dr. Eamon Staunton is also on hand.
Can you even okay?
I can, but I have got pain in it.
At the moment.
Darren suffers from a heart abnormality that can cause his heart to beat around 3 times faster than the average heart.
Darren's condition is currently potentially life-threatening because his heart rate is very high. This means that he's having reduced blood flow to his heart, which could cause him to have a heart attack.
Can I just move these away as well? You were just getting up for work and you noticed the heart started going really, really fast. With this particular rhythm, it can be quite dangerous, so you have to be careful how we treat it.
I get to open your mouth as wide as you can and say ah.
Ah.
Perfect. I understand you've had cardioversions a few times before. So do you understand what we're going to...
Yeah.
Fine. So we're going to have to cardiovert you to get you back into normal rhythm again, because you can't stay in this rhythm at this speed.
So this has happened to him quite a lot of times. And so we've decided to give him some electricity to the heart to shock it out of that rhythm rather than any medication.
As with everything we do, there are risks and there are benefits. So about 100 times we do this, we'll have to give you some assistance with your breathing. There's also a risk of the cardioversion not working.
Right, little sip, not too much, don't gulp it. And just sit you up a little bit. While you're sitting up, we'll just slip your t-shirt off, sweetheart. That's it. You relax your arm down now.
The doctors prepare Darren for his radical procedure.
How's the pain? It's like it's still in waves, like you were saying earlier.
Still in waves. When it comes, it's around about a 7 or 8. But when it's not there, it's not too bad. It's not as bad on the chest.
Hopefully, you'll feel a lot better in a few minutes.
Close your eyes, think about that happy place, and stay as chilled out as you can.
Everybody clear?
Yeah, so oxygen's away.
With everything in place, the team is ready to perform the shock procedure. Outside, Barnsley is being battered by Storm Eunice. Inside, in Rhesus, 44-year-old Darren is suffering from severe chest pains and a rapid heartbeat.
How's the pain?
When it comes, it's around about a 7 or 8.
Dr. Mason and Dr. Staunton have performed a cardioversion on Darren.
Everybody clear?
Yeah, so oxygen's away.
An electric signal they hope will shock his heart back into a normal rhythm.
It does make me a little bit anxious. Obviously, we're fiddling with the heart, and you know it can be a slightly anxious moment knowing whether the heart's going to, how the heart is going to react. All right, Darren. Well done.
Okay, mate. All right.
So you're in hospital.
Darren? You're in hospital, pal. You're all right, mate.
So keep taking those massive breaths in. You're in hospital. You're safe. Your heart rate's no longer going fast. Darren? You okay there, mate?
Darren is slow to respond, which is a worrying sign.
Do you know where you are, Darren? Darren?
The storm is continuing to cause mayhem.
There's a tree across the road that's been uprooted. Across the road.
Healthcare assistant Kerry and student nurse Jessica head outside to inspect the damage.
Oh my God! Oh,
Meanwhile, in cubicle 9, 88-year-old Enid is suffering with an 8-inch open head wound after being blown over by high-speed winds. Gordon, her husband, is with her.
He's a bad one. He's a bad one.
Will you give up saying it? I know it. I can't see it, but...
I know. I can't help it. I've never seen a wound like that before.
I've popped this under your head.
The doctor arrives to stitch Enid's wound.
Did it bleed a lot?
Yes.
Yeah. So what I'm going to do first is put the anaesthetic in, okay? Just let me know if you need me to stop. It's going to be a bit sharp.
Anaesthetic is essential for such a deep head wound, but receiving it is a painful experience.
Same down this side. Can you feel me poking? No. How about here? Good. Here.
Just pick it up there.
Is it a bit sharp? Sorry.
With the anaesthetic getting to work, it's time to stitch up Enid's wound.
Right. Is that okay? Good. It's coming together, isn't it?
It is, yeah. I think you're doing a good job, yeah. Tougher than what you think. How long will it take to knit together?
Oh, so within a week it will start of been coming together. We usually
yeah.
I'd say to take sutures out about 7 to 10 days.
Will there be a scar?
Yes, I will say there probably will be a scar, but obviously you've got a lovely set of hair, so you won't see it. Yeah, you're going to have...
It'll not be prominent though, will it?
No, I don't think so, because it's such a clean cut.
Yeah.
It'll
look like that's the Mohicans, isn't it?
Yeah, well you'll have to grow a Mohican over it, and you won't be able to see it then. But yeah, it's a big one.
It could have been worse, it could have been my face.
It could have, you're
Very
right.
good.
As Enid is given time to recuperate,
So I'll leave you there for a bit.
in the hub, volunteer Jane is on lost property duty.
Anybody lost any shoes? Are they your size?
No.
Is there Cinderella knocking about? There's a pair of shoes here. Just we know how long they've been here. I'll put them in here for now. Somebody who's obviously not going to walk out at hospital, is it, with no shoes? So if anybody's lost any shoes, there's a pair of size 12s there. I can remember when they didn't want us to wear Crocs.
Yeah.
In A&E, can you remember that? Yeah. But I can remember a time when they didn't want you to wear trainers either. That's it. You all right, love? Are you warm enough?
Over in paediatrics, they see approximately 60 children per day.
Who have you got here with you today?
New to the department, nurse Alicia is taking care of 2-year-old Holly.
Who's that? Daddy? What's your name?
Adam.
Holly and her sister Olivia were playing with Play-Doh when Holly got her finger stuck in a toy.
Has she had any medication today?
No.
No. Holly, would you like some Calpol, some paracetamol? Does it hurt a lot? Do you think she'll benefit from it?
So she's not going to say no to that.
Will she benefit from it? Just while we're trying to get it off.
Yeah, probably
Yeah?
will. She's really drunk.
I'll go get her some.
What are you writing? What are you writing?
I'm writing about you.
Me?
Mm.
And Olivia?
Yeah, I'm going to weigh her.
La la la.
Where are you now, Ellie?
Holly,
Holly?
Holly.
can I lift it up and look at the bottom? Ready? Above your head.
On my head.
Yeah. Lift it up. There we go. Thank you. I think what we might have to do, Dad, Doctor's going to come and have a look because it's plastic. We might be able to cut it off ourselves. And then try and get in there and straighten her finger out so she can pull it out.
Will it turn green?
Will it turn green?
Yeah.
No. Not on my watch, it won't.
Before she tries to free Holly's finger,
Oh, Doctor's here.
Dr. Cara Evans takes a look.
Hello, Holly.
We were playing with Play-Doh down.
Yeah.
The next thing I noticed, I saw her finger stuck in there.
Your finger was stuck in there.
Yeah, this thing.
Can I have a look at your hand, Holly? Yeah? How did you do this, sweetie? You can let go with this hand. You can let go with this hand. Because I think if she straightens her finger, it'll come out, won't it?
I was trying to straighten her finger at ours and she just couldn't.
Yeah.
She was flexing it, but she just couldn't fix
Yeah,
that.
oh yeah, mate, what trouble you've made, Holly. Shall we come out this room? Yeah, I'm going to put her in maybe the treatment room, and we will
Come on, darling.
come and see.
With children that got their finger stuck in something, sometimes a bit of lateral thinking to work out how the finger is going to get out of whatever they've stuck it in. But certainly a unique emergency department challenge, getting fingers unstuck from objects.
Can you hold Daddy's hand with your other hand? I'm sure you can. Sure you can.
Come on, Daddy.
Come on, hold on. Come on, get it off, Holly. You're taking it off.
I'll take it off. I know.
With Holly distressed, Dr. Evans is struggling to unscrew the toy. One wrong move by Holly could cause serious damage to her finger. All patched up, Enid and Gordon are finally allowed to go home.
It might have to be a new coat.
Not again. We'll take his rubbish away.
We'll take your rubbish.
I'll put it in there.
You go in. See you
you later.
Wait till I can't turn round quick.
Bye.
Bye. Thank you very much.
See you later, love.
God bless the NHS.
And then everybody's had.
Over in Resus, Darren's been struggling to come around after his electric shock procedure.
And then do that yourself. Do you know where you are, Darren? Where are we? Brilliant.
Well done. Well done. That was brilliant.
Oh God.
Really
Yeah.
good. It's worked really well. Bet you're ready for a cup of tea now, aren't you? Or coffee? We'll
Yeah.
get you one in a bit.
I seem to feel a bit better.
You feel a bit better? That's
Feels like it.
good. Well, that's because your heart's behaving itself a little bit now, so
Good.
your blood pressure's come up, and that pain that you had across your chest should start to feel a bit better now.
Yeah.
So you'll see that's done a really lovely job of taking him out of that really rapid rhythm into the slower rhythm now, going at 66, 67. So we just need to make sure he stays like that. We'll do another heart tracing and just check that out. Thank you. This was the first one, really rapid, as you can see, lots of activity. And then now we've slowed it down, it's gone back to a more normal looking rate, although it's not a completely normal looking heart tracing, but that's because of the underlying problems that we already know that Darren's got.
Darren's heartbeat might be back to normal, but Dr. Mason has some news.
Hi Darren, how you doing?
I feel a bit sick.
Yeah.
And like drifting.
So your blood test has come back and it's gone up a little bit more, which
Yeah.
is concerning for your heart and worries us that you may have had a heart attack.
Yeah.
We can't be absolutely sure, but it does, you know, it does indicate that we need to give you some treatment for that. Giving bad news or difficult news to patients is always challenging. So in Darren's situation, he's had lots of treatments for this problem and none of them have worked. So, you know, it must be really difficult for him to be able to have to deal with the knockbacks he's getting all the time. It might explain why he's still feeling a bit rubbish. I'm really sorry about that.
It's devastating news and means Darren's recovery won't be straightforward. There's still a huge risk his heart won't be able to cope with the strain it's been placed under. Outside, the storm is continuing to sweep Barnsley,
You're soaking.
but it's not stopping patients arriving.
Is it throwing it down outside then? Is it? Don't know, I've not seen. I'm stuck in here. Nails are nice.
In the hub, paramedic Sam has brought in 77-year-old Eric with stroke-like symptoms. Sam is briefing Sister Jo Hunter, who's also his mum.
So I woke up at 7:30 this morning with some aching in the back of his neck. Had some right-sided facial droop, and then his speech sort of a bit slurred and a bit slower than normal. Well, finish it for you. Right, Eric. Hello. All the best. They'll get you sorted now, all right, hopefully.
Smashing.
Morning, Eric.
Hello.
My name's Joanne. One at nurses. Can I just check your blood pressure and that
You
all
can.
again?
Yeah.
How are you feeling now?
Perfectly all right
You
again.
back to your
Back to
usual
normal.
self?
I just can't believe it.
Put your
Bloody
finger in
blood
there
pressure
for me.
again, innit?
There, no. Can I ask you to squeeze my hands? That's lovely, and release them again. Can you lift this leg up for me? That's lovely. You push against me. Push against my hand. That's lovely. And same with this one. That's it. Do either of your limbs feel weak or anything?
No.
No, they feel back to
Yeah.
normal.
Yeah.
Fabulous.
Consultant Dr. Andrew Greer needs to assess Eric urgently.
Hello, my name's Drew, I'm one of the doctors.
Right.
What's happened?
I woke up this morning. I was going to football club because I do a lot of volunteering work up there.
Yeah.
And I set my alarm, woke up, and my neck pain, pretty horrible. And as soon as I got in the car park at Borough, couldn't see now. And my pain in the neck, oh, unbelievable.
You still got the neck pain now?
No, not at the moment, no.
Any headaches at all?
No, not anymore. I've had plenty after when I fell on concrete.
I get you to bring your mask down for me. Give me a big smile, show me your teeth. Now obviously this is the first time I've met you. To me the left side of your face looks a bit different to the right.
Right,
Would you agree with that or you're not sure?
not sure.
Fine. What do you think, Joe?
I thought he'd got some left-sided.
Yeah. So have you had a head injury previously, is that
Yeah,
right?
bleed on my brain.
Did you have any surgery for that?
No,
The
they
observed
were near enough.
What I think we need to do is just arrange another scan of your head.
Yeah, okay.
Now it may well be that we need to look at your neck as well
Neck
at some
as well.
point,
Yeah.
just with this neck pain. Because sometimes if there's problems with the blood vessels in your neck,
Yeah.
that can cause headaches,
Yeah.
it can cause problems with your vision and things.
Yeah.
But I think we'll start with the scan of your head and then we'll take it from there.
Yeah.
Is that okay?
Yeah. Shut up.
The team needs to get to the bottom of Eric's symptoms as quickly as possible. A bleed on the brain or stroke could be life-threatening for Eric.
I hope I haven't had a stroke. Yeah, that's all I need. But all been well. It's just the blood pressure again.
44-year-old Darren is in resus. Since arriving this morning with chest pains and a rapid heart rate, he's had his heart shocked and might have had a heart attack.
There's a chemical that's detected in the blood called troponin, and it's a really good way of testing whether people have had a heart attack because the troponin levels in the blood go up very quickly. And so we do these tests quite a lot when people come in with chest pain. So it could be a combination of obviously what's been happening to you this morning and the drugs that you've had and things that's made you feel like this. But we're going to give you some more drugs now just to upset things. But hopefully that will protect your heart, which is our primary concern, really. All right.
Yeah.
Okay. And we'll obviously be keeping you in hospital for a day or two until we've worked out next steps with you.
Yeah.
Okay. Any questions or anything?
No, I can't think.
You're all right for now. All right, Darren.
Yeah.
Okay. All right, smashing. Thank you.
Okay.
But Darren's heart rate is not stable and begins to slow down. It becomes dangerously low. Dr. Greer takes a look at him.
Just going to give you a bit of oxygen to breathe, okay? No, keep that for now, you're all right.
Well done, Paddy.
Yeah.
Yeah, bro.
Keeping us on our toes, aren't you?
Yeah.
Unable to keep Darren's heart rate at a normal level, the team is getting increasingly concerned.
We'll use these ones, they're a bit more reliable.
The reason we keep patients with these types of conditions in a monitored bed in resus is because they often can become quite unstable quite quickly. So because of ongoing restriction of the blood flow, probably to the bottom part of Darren's heart, his heart rate dropped very low and he had a fainting episode because of lack of his heart not pumping the blood around effectively enough. We've given him a drug called atropine, which speeds your heart up, and we're going to give him an infusion of a drug that will keep his heart rate at a normal level as well.
All the team can do now is wait and hope the drugs take effect.
What's the wait time at the minute, mate?
In paediatrics, Nurse Greg and Nurse Johnny are comparing notes.
I saw a 4-year-old with a marble stuck up his nose.
Nice.
That was pretty decent. His mum did the mother's kiss and it fired out and hit the sink.
That's pretty good.
That was pretty cool.
I had cheese up someone's nose last week.
Cheese?
And I asked him why he'd
What,
done
like
it.
a block of cheese?
No, it was like a little bit of cheese.
I thought
He
you
picked
meant
it off and put it up his nose, and I said, why have you done that? And he just went, because it fit. Fair enough, it's a good answer.
In cubicle 1, Dr. Evans is trying to get 2-year-old Holly's stuck finger out of a Play-Doh toy.
All the different colours. Which colour would you like best?
The pink, I bet you like the pink one, don't you?
I do.
Which
Yeah.
kind of one?
The green.
Yeah, if you would.
Blue.
Still struggling to unscrew the toy, Dad Adam gives it a go.
I've never seen anything like it. Normally it's a ring.
You're doing so well, Holly.
This next one's going to be difficult.
With Holly becoming increasingly distressed, the team try its hardest to distract her.
Holly, would you like to look in that one? Look. All different colours and shapes.
The distraction seems to be working. Holly calms down, letting Dad Adam unscrew the toy.
I did it with this.
There you go. You didn't use me at all. You were very clever, weren't you?
I'm going to get some stickers now.
Can I have a little look at your finger? Turns out it was actually just Dad helping her to take the finger out was what solved the problem for us. So much more straightforward actually than I was anticipating. Can you bend your finger like this for me? Go on then. Oh yeah, well done. Good girl. So she's moving it just fine. She's not tender anywhere and the blood coming back in the end of her finger. So I think she's all good to go.
Perfect.
There you go.
Ready?
Patient where I've done the least all day. You've done it all. Bye.
Bye, girls.
Thank you, see you later.
Bye-bye, girls.
Darren's heart rate has stabilised again, and he phones to update partner Wendy.
Got results of my blood. They think I have an heart attack. I'm going to put me onto the ward. Give me some more drugs because I feel a bit rubbishy here.
Darren was kept in resus for 6 hours before being taken to the cardiology department, where his medication was changed. 2 weeks later, he had to return for another cardioversion, which worked, and Darren is currently doing well. 77-year-old Eric has been to radiology for a CT scan after suffering from a suspected stroke.
Bloody hell, that was quick.
Last year, he had a bleed on the brain. Dr. Richard Gentles takes a look at both scans.
So that's Eric's scan from December last year, where all this grey bit is his brain. That sort of wiggly bit on the outside is completely normal. That black bit in the middle is completely normal. This brighter white part at the front indicates that there's some bleeding there at the time. And then today's, he's got a vessel there. So that side of his brain has got this nice wiggly line with some black around it. Straight line down the middle. He's sort of lost the wiggliness of his brain, and it's been pushed across to about there by this slightly different shade of grey. And that's blood that's accumulated there for some reason.
With a further bleed on Eric's brain detected, Dr. Greer now has to investigate his neck pain in case there's a connection.
Have you still got neck pain now?
A little bit, but not as bad as it was this morning.
Have a little press here. You got any discomfort there?
Yeah, I feel some of that.
A bit discomfort there?
Yeah.
Is it alright around the back?
Yeah.
The reason I ask, has it been explained to you what your scan has shown?
Yeah, some more bleed, isn't there?
Yeah. What I'm worried about as well with the neck pain, sometimes this bleed can be because of the blood vessels in your neck. So I'd like to scan your neck as well. We've obviously done your head already. It's going to be an MRI scan that we're going to do of your neck.
Lovely.
Have you got any metalwork in you?
Metalwork. No.
Any aneurysm clips, any coils?
No. Okay.
Lovely.
Lovely. Thank you. Another scan. Smashing. I've been complaining about this neck pain for ages and ages. My wife keeps saying, go to doctors, and I hate going to doctors. But I should have done.
7 hours after being admitted, he's off for his second scan of the day.
Just keep your hand in it, fellas, buddy. That's it, mate. Easy. Right, taxi driver.
Senior MRI radiographer Andy Hardy conducts Eric's scan.
We'll start from scratch. So it's 2 parts this,
we're going to look at your head, which will take about 10 minutes, and then we're going to look at the blood vessels in your neck, which is about another 10 or 15 minutes.
Right. Okay.
One that scans right at the end is injecting a dye through this cannula that you've got in your arm. We watch it go through your heart, and as soon as it starts filling blood vessels from your heart up into your head, we start scanning. And we're trying to see if there's any little tears or blockages that might explain your symptoms. Alright.
Emergency buzzer. Just give that a squeeze if you need us, okay?
Yeah.
Just bring your head slightly forward for me. Okay. And a little bit of equipment over the top. This is what takes the pictures. Okay. If you look up into the mirror, can you see me waving? Yeah? Okay.
Here we go, Houston.
Radiographer Andy first concentrates on Eric's brain.
4 minutes to noise coming now. This particular type of scan assesses what we call diffusion and flow in the brain. Really good indicator as to whether there's been any sort of brain damage from a stroke, either from his bleed or from sort of brain tissue dying off where blood supply has been interrupted. How you doing, Eric? You all right?
Yes, sir.
Okay, we've only got scans looking at your blood vessels left to do now, all right? Well done, fella. Come in and bring you out.
Yeah. We're back from the moon.
While Eric is wheeled back to Casualty, his scans are analysed.
This is a scan for this chap's blood vessels. So this is what his aorta leaving his heart. These two diversions here supply your neck and your brain, and they divide at this point to become vertebral artery and internal carotid artery. And this piece of artwork here is what we call circular Willis, and it's a ring of blood vessels and joins deep in the centre of the brain, and nature's designed it so that if you get a blockage on one side, blood can still flow around that circle. So what our specialists will do now, they'll do a detailed analysis of this scan. They'll make models of it, spin it round, and have a look from different directions just to see if there's any sign of any tears, any narrowings or occlusions as we call them, that explain this chap's ongoing neck pain.
If there are tears in the blood vessels in Eric's neck, untreated, they could be life-threatening. In Barnsley, Storm Eunice is still raging.
My barbecue cover blew off, but it got wrapped around my giant umbrella, so it's fine. I'm not putting it back on, I've trapped it under a gas bottle.
But it's not stopping the Casualty team treating the growing number of emergencies. And in paediatrics, Nurse Greg has his next patient.
All right, Harvey, would you like to come and sit on this chair in here? I want to ask your mum some questions, is that okay? Good lad.
5-year-old Harvey injured his head at school. He's been brought in by Mum Melanie and little brother Barney.
And is he allergic to anything, Mum?
Not that I know of.
I'm allergic to...
Homework?
Yeah.
Yeah, that's fine. Do you want me to write that down? I chose to do paediatrics because I thought if I want to be a nurse, I might as well work with kids as well. And I'm a big kid at heart. Still get Lego for my birthday and stuff like that. I absolutely love it. Harvey, does your head hurt?
A tiny bit.
Would you like some medicine to make it feel a bit better?
No, thank you.
Are you sure? If you decide that you do want some medicine, will you come and get us?
Yeah.
Good lad. All right, Harvey, can you tell me what happened?
So I was at school and I was running through this red fence and I hit my head on the fence and it was bleeding.
Oh dear. And do you remember it happening?
Mhm.
And have you been sick?
No.
Good.
I've never been
School didn't
sick.
say he knocked himself out, did your mum know? You've never been sick?
No.
Ever?
No.
Never, ever?
No.
Wow. Right, mister, we're going to have a look at your head, OK? And we'll give it a clean and then we'll be able to decide if the doctor's going to put a little bit of glue on it. And if they do, I can glue it for you. Yeah? So we'll do that, we'll give it a clean, we'll dress it back up and we'll wait to be seen by a doctor. How does that sound? That kind of cool? All right. Let me have a look, buddy.
Cool.
Really cool. Did school do this?
Yes.
They've done a good job. Let's have a look, buddy. Oh, that'll glue nicely. Am I right to give it a clean? Good lad.
Mhm. It hurts.
Sorry, buddy.
A little bit.
What we'll do, we'll put a nice wet bandage on it and let it soak, and that'll get rid of it, because it's a bit stuck at the dry blood. There's dry blood in your hair, and it's a bit stuck, so it's pulling on your hair. All right, it's lovely and clean, that, Mum, so it should come back together really fine. All right. Should we put another bandage on your head?
Yeah.
Good lad.
Well done.
In a second, I'm gonna have a look in your eyes. All right. Right, can you hold that on there for me? Good lad. Some kids, when they come to the hen and dre, they can be really, really quiet and withdrawn, because obviously they've had that big rush of adrenaline when it's happened, and then all that adrenaline's gone, and now they're a bit tired.
Oh, yay!
But Harvey's coming to ED today, like nothing's happened. All right, I'm gonna have a look in your eyes, and I'm gonna ask you to do some silly things, okay? Right, you look at me. Look at my nose. Fantastic. Should we check if you've got a brain too?
Yeah.
Yeah. Oh, the light went all the way through to your other side, which means you don't have a brain. Right, can you stand up for me?
I do have a brain.
Do you have a brain? Can you hold my hands? You squeeze as hard as you can. And can you jump up and down for me? Good lad. Put your arms above your head and clap. Good lad. Fab, you can have a seat in the waiting area, Mum.
Thank you.
You're very welcome, buddy.
It's all sticky.
In Casualty, Eric's waiting for the results of his MRI scan after suffering from a further bleed on the brain and severe neck pain. His wife has come to see him.
Yeah, they're going to put me in the ward.
Dr. Sean Burns has taken over Eric's treatment and has some news.
Hello.
Hello.
Hello. So we've had a speak to the doctors over at Wakefield Pinderfields Hospital.
Yeah.
You're going to go across there. Okay.
Right.
So what's happened is the neck pain you had is probably one of the arteries in your neck has ripped.
Yeah.
Okay. And when it rips, it blocks the blood flow to your brain. Okay. And where it is at the back, it gives you symptoms.
Right.
Like you've had this morning, because it's technically a type of stroke. Okay. A strange stroke that we don't see very often, but a stroke. You need to go across there to be managed best.
Eric was transferred to the Royal Hallamshire Hospital for treatment of both his conditions. Surgery for the bleed on his brain was successful, and his artery tear is still being monitored by the hospital.
I heard someone say my name.
In paediatrics, Nurse Greg is back with 5-year-old Harvey.
Hello again, mister. Mike, can I have a look at your head?
Yeah.
He says I can come and glue it. Is that all right?
Do you like superheroes?
I love superheroes.
I know you do, and I know which one it is.
Go on, then.
Iron Man.
No, my favourite's Thor.
Oh.
Who's your favourite?
Spider-Man.
Spider-Man. Have you seen the new Spider-Man?
Yeah.
Do you want to lie down? You look at that lion for me. What noise do lions make? Good lad.
Can you not try to do it too rough?
Yeah, I'll be a bit more gentle.
Okay.
Right, nice and wet then.
Okay.
He's a proper bloke, Harvey. Really, really confident. Definitely a Yorkshire lad. Really, just straight to it. Here's what I've done. Yeah, you can do it.
It stings a little.
It will do. I'm nearly done cleaning. All right, nearly. Stay nice and still. I'm nearly done.
Okay.
Right. Cleaning's done. I just need to dry it now. All right.
Ooh. That doesn't hurt. It hurts a tiny bit.
It will do a tiny bit. Right, you need to stay nice and still while I put this glue on. All right.
Okay. When I'm older, I'm going to be Spider-Man too.
Are you? I think you'd make a fantastic Spider-Man.
I couldn't even feel a thing.
Good, we're nearly done.
How much more dabs?
Not many.
5 or 1?
Less than that.
1.
Nearly done. I'm just waiting for it to dry.
0 then.
0.
Mm.
Maybe one more dab.
Okay. That was not 1.
It was. I'm just waiting for the glue to still come out. There we go. All right. Wait a second. Yeah, do you want to have a look, Mum?
Oopsies.
Lovely.
Yeah, are you happy with that?
Yeah.
Yeah. You're very good. I'll give you some advice sheets to take home.
Yeah.
Yeah. Oh, have you driven me? Oh, thank you. That's amazing.
Do you want to read it to him?
Go on, do you want to read it?
To Greg, I love you. Thank you, from Harvey.
Thank you, Harvey. That's very nice. Thank you for being super, super good. Do you want a sticker to take home with you?
Please.
I've got stickers with my name on it, so you can have one of them.
Oh, you'd love that.
Yeah. I've got superhero ones. I've got Spider-Man ones.
Can I have a Spider-Man?
Yeah, of course you can. There you go.
Thank you.
You're very welcome. You get home safe and watch that head.
Stick it at the end of Harvey. Harvey's Spider-Man.
I'll see you soon.
Yeah.
Outside, Storm Eunice has finally subsided, and Nurse Greg is clocking off.
I love my job, yeah, I really do. I think it's absolutely fantastic. Like I say, I'm so glad that I chose to do nursing. I never wake up and think, oh, I've got work today. I'm always excited to come to work. I'm always looking forward to it.
And while he goes home for some rest, Barnsley Casualty is ready and waiting for its next patient.